Gallagher told you, it's not just a didactic sort of passive learning program that we're talking about. The market differentiator and why Lifeguard is going to be one of the market leaders in how you get education is that it will involve that active learning component. We're developing this program with our partners at Penn, Dr. Martin Cheadle, who's the Director of Behavioral Medicine at the Penn Pain Medicine Center, and Dr. Michael Ashburn, who's the Director of Pain Medicine and Palliative Care at Penn. The depth of Penn gives us credibility in that depth and breadth of the learning program that we're going to offer. We'll be offering this in Philadelphia to start, but we hope to be able to offer this actually across the state as we continue to grow the program. We have a multifaceted approach to learning, and so we're going to use all of those tools. So how does that start? How do you know where to begin with me, right? Well, we have a very secure portal through which you will upload some of your patient records for those who you have prescribed opioids. And we will have individuals reviewing those records before you arrive. You will take a pretest so that we know where you start with your base of knowledge. Where are you beginning at? And we will also have a requirement that you take 6 of our courses that are offered by the Pennsylvania Medical Society now that are basic opioid prescribing courses as a pre-learning requirement before you come in the door. So I get there. Then what happens to me? Well, it's a 2-day program, and you will go through small group discussion. You will use standardized patients, and we'll use a case-based learning approach. So we're talking about 44-year-old white female presenting, and we go on with the case. And we actually discuss cases. We also remember we have your medical records. So we are able to use even some of those cases if we feel it's pertinent to discussion for the learning of yourself or for your learning of the group. Some of the goals that we'll address, and there's a list of about 50 goals, but just a few that we plan to address are describing the nature of chronic pain and options for its treatment, selecting patients who are appropriate candidates for opioid management, recognize the importance of consistent screening for risk prior to prescribing, recognize the importance to establish and document treatment goals. Documentation is one of the biggest problems that we see. Physicians know full well what they're doing. Their knowledge is fine. Their documentation sometimes, not so much. Following an evidence-based protocol for starting patients on opioid analgesic therapy, including safely initiating and titrating opioids. Following an evidence-based method for monitoring of a patient's response to therapy. Outlining the importance of medication reconciliation at every visit. Recognizing the usefulness of the PDMP when prescribing and dealing with patient issues. Now, what's nice about Lifeguard is we are offered as a program to Pennsylvania physicians. We are here as a service to our members across the state. We are also a service to physicians across the nation. So as physicians come into the Lifeguard program, if you are in the Be Safe, Be Smart, Be Sure program, we are actually looking at the PDMP requirements in your state. So for instance, even though we don't have this program fully fleshed out, we did have a doc that came through the other day with opioid prescribing issues in Ohio. And we're able to say, what is Ohio requiring? What do we have to do to make sure that when you return, that you are doing the things to follow your state guidelines and your state requirements? We're going to talk about recognizing problematic or aberrant drug-taking behaviors and distinguishing unintentional misuse and chemical coping from deliberate misuse, abuse, and addiction, and outline a time-efficient approach to dealing appropriate with aberrant drug-taking behaviors, including opioid dose adjustment, discontinuation of opioid therapy, and the possible referral to specialist care. Well, that's like a lot of learning. But we're going to bring in, beyond our experts, Dr. Cheadle and Dr. Ashburn, we're going to bring in someone from the DEA. We're going to bring in someone who is a state prosecutor. We're also going to bring in someone to talk about the stressors of what it really means to be a physician who has an opioid-seeking patient in their office all the time. It's real. That stress of that person that is demanding, requiring, threatening, talking about your Press Ganey scores, you name it, We are going to talk about that real stress and what does that mean for you as that physician, and how do you cope, and how do you firmly and assuredly, when it's appropriate, say no, and know that the next handoff, that you are sure of what the next handoff is for that patient. At the end of this program, we'll be able to know that your knowledge has changed through your discussion in small group, through post-testing, and through how well you manage those standardized patients. In the cases that we are writing with the standardized patients at Penn, they are going to push the buttons of the physicians who come into this program on purpose to make sure that you are sure and smart in the behaviors and the practices that you'll be using as you move forward in managing your patients. On the backside, as an optional service, we are offering monitoring for those who would like to continue to upload some of their records through the portal for a period of time to be sure that their learning has changed and that their behaviors have changed. This can be optional in the fact that the doctor is choosing this, or this could be required if this physician is known to the state board and the state board is saying, we want to be sure that there has been a change in behavior. We will be able to do that. We're talking about 10 patient records coming up through in a month's period. They will be reviewed, and that individual physician will have one-on-one discussion with our experts on what could be changed, what should be documented differently, to make sure that that's a one-on-one learning experience through that monitoring. And again, that's optional. Not everybody is going to choose that. So I mentioned that it may be that a state board says you need to take this, and you may say, well, is this just, a program for those who have problems? Is this a bad boys club, a bad girls club? I hate to use that phrase, but often I have docs say, well, why in the world would I want to take this? I'm not in trouble with anybody. And I would say, I can't tell you how many times on the other side of the coin I have a doctor saying, I'm afraid to prescribe opioids anymore. And if I have a program like this that can help me be sure that my practice is right and my practice is good, I'll happily take this. So this is not just for those who may have an issue that arises. This is for those who want to be proactive in their own learning and in their own competence when they are talking about opioid prescribing. And for some, it will be reactive when an individual may be known to the state board for a problem. We expect this to launch in September, as you were told. So please stay tuned. You can go to our website at www.lifeguardprogram.com or to our foundation website, which is www.foundationpamedsoc.org. The last thing I will leave you with is we talked about what we're doing for others, how we're taking care of patients here. But we also do have within the foundation a program that is very personal and very specific to physicians. So if you are a physician that not only is struggling with prescribing to others, we actually have a program called our Physicians Health Program for physicians who are themselves addicts. So we have two programs, very personal. Very personal in your competency side with Lifeguard, be safe, be smart, be sure, and the Physicians Health Program, which addresses if you yourself are an individual struggling with addiction. And we're here to help.